All right, I'm recording. I'm recording. We're good. All right, everyone. So it's just one of those days. We're all just sitting in this cloudy weather, just trying to really understand what's going on in the world and if we are ever going to get back to normal. So trust me, I'm there with you. And it's definitely been an interesting few weeks of, just reflecting on everything. Hi. But just, obviously as a business owner, trying to navigate and see what's going on, keeping up with, where are we at? Are we opening anytime soon? Are we getting back to normal, etc. And I couldn't help but come across the most recent article about reopening New Jersey. And going through the information, the top three things that are being stated is that social distancing, that is going to have to live on even, going forward, and that more than likely kids are going to have to be wearing masks while they're in school with each other, as well as continuing to stay 6 feet away. And this was just something that really struck a chord for me, not because of necessarily the coronavirus, but more so looking at the big picture here. And what I mean by this is the fact that we're requiring children to wear a mask to prevent the spread of disease. But in reality, is anyone necessarily going to make a modification to the fact that these kids are going to be fed processed food, chicken nuggets, pasta, and French fries, when we really look at the statistics of obesity and chronic illness in kids compared to how many kids have actually been affected by the coronavirus? So it's just, as an integrative practitioner, I'm having such a hard time just mentally and emotionally going through this period of time, because some of the things that we're talking about are just so ridiculous. We are completely ignoring the fact that kids are sick. Everyone is sick with some type of autoimmune condition, chronic illness. We're all tired. We all have digestive complaints. Nobody sleeps well. We have all of these lingering issues that our non-comprehensive blood work says, oh, you're fine. It must be that you need to, you might be depressed, or, it might be your anxiety. That's the new thing, is that everything is because of anxiety. And, oh, we have to really protect our society from the coronavirus, when you actually look at the people that are most susceptible to the coronavirus, and it's people with heart disease. And when you start digging into the statistics of how many people are on medications for hypertension or high blood pressure, it's astronomical. The leading cause of death in the US is heart disease. So no wonder why we should fear the coronavirus. But we're going to put kids in school and we're going to completely ignore the elephant in the room. And we're not going to acknowledge that these kids are eating processed crap and being advocated to drink milk. And some schools, they have to pay to drink water. But it's completely free to drink milk. So milk being mucus producing and pro-inflammatory, which specifically affects the respiratory system in a virus that we are trying to protect our kids from. So this is just so beyond absurd. And the fact that even in certain states right now, they're not classifying fruits and vegetables as being essential. But you can get all the Doritos and Yodels and everything else processed that you can imagine, but you don't necessarily need to eat fruits and vegetables. We're actually ignoring physiology, and we're ignoring immunology. And I know that there are other people that are in this field that are speaking up and that are speaking out about, when we're in this much fear of a virus, it's because we don't even understand immunology or the immune system in general. And when you do understand how it works, you understand that you don't necessarily have to fear this to the capacity that people are. Listen, I know people are passing away from this. I'm not saying that it's no big deal. But when we actually look at the nitty-gritty of the people that are passing away from this virus, these are people that were already sick, if they knew it or they didn't. Because I have people come through my doors all the time that are like, I have stomach aches, I have migraines, I'm so tired, I can barely get out of bed. You start running better lab testing and you actually find that these people are suffering with chronic illness or autoimmune conditions or have more serious conditions than they thought. And this is not a few of my patients, this is most of my patients. And unfortunately, when we're talking about, the elderly being vulnerable to this, yes, that is correct. And it's correct because they're the most mistreated population. We are talking about an older generation that by the age of 60 and up, they are on 5, 6, 7, 10, 20 medications. I have had a patient come through my doors, 68 years old, on 32 medications. So they're on medications to treat lifestyle conditions, but then they're also treating the side effects of the other medications. And when you actually do better testing, this demographic of people are struggling with anywhere between 3 to 7 autoimmune conditions. Yes, people, you can have 7 autoimmune conditions. I literally just had a patient come through my doors. She told me that she was told she had rheumatoid arthritis, she has pain everywhere, and she's having shortness of breath with random coughing, and she was having blood. This is way before the coronavirus, people. But I did her testing and she had 5 autoimmune conditions, had no idea, and was being prescribed a variety of therapies, treatments, medications that had nothing to do with the root cause. And in addition, this woman was a ticking time bomb for a stroke because she had a very specific autoimmune condition that causes blood clots. And that was the reason why she was having respiratory issues, is because she had blood clots in her respiratory system. So this is what is happening. These people are sick. If you have symptoms, and even though your blood didn't pick up on it, chances are you have something going on that is just being missed. So again, I'm kind of going on this rampage because at this point, I'm just at my wit's end with hearing about how a mask is going to protect the population, and we're going to put kids in school and we're going to make it weird. Don't talk to your friend. Don't touch your friend. Don't hug anybody. Don't have interaction. Keep a mask on too, because that's the way that we're going to protect ourselves. But drink the milk, eat the French fries, and eat the chicken fingers. Like, it's batshit crazy, people. Like, this is insane. In addition, okay, the second thing that we need to open up our state, and I'm sure this is happening in other states, but I'm just speaking on behalf of New Jersey. Testing, testing, testing. Testing, testing, testing. Okay, testing. So in reality, the reason why I do what I do at this point and why I have all this weird technology, and I have technologies from all different countries in the world, is because I have seen so many flaws with testing, so many errors. So some of you listen to my podcasts or my webinars, and one of the stories that I tell over and over again as to why I do what I do is because I had a very specific scenario early on in my practice that I ran blood work. This was right when I started having a phlebotomist in my office. And the phlebotomist who draws the blood drew the blood, X amount of vials, it was shipped out to the lab, and the lab processed the same blood twice. I don't know why, but they processed the same blood twice. So I had the patient in the portal twice, same blood. In one, she had active Lyme disease, 5 bands in a Western blot that were positive. In the second, she had no bands, aka negative Lyme disease. So 5 bands to 0 bands is a huge difference. So pretty much what you have to understand is that this was the same blood. It was processed by 2 different people, 2 different techs. And one resulted in active Lyme disease, which would have required very aggressive treatment, and one was completely negative. And when I talked to the lab, they had 0 answers. They said, run it again and let's see what happens, and we'll see what the common denominator is. That was the answer. And at that point in time, I started to really understand that there is so much room for error when it comes to testing. So in reality, we should be using various forms of testing to actually decipher what the problem is. And in addition to that, now we're having all of the press telling us about antibody testing. Okay, so antibody testing shows us a memory of our body coming in contact with something. So you could have come in contact with a coronavirus 5 years ago, 10 years ago, like we said, is there's certain people that are having the virus that's causing like a minor flu type symptom. And then obviously we have other people that it's causing a way bigger issue. But we're talking about viruses that have many different faces. We are talking about an Epstein-Barr virus that can cause people to have full-blown mono and not leave their house for 6 months and have to be out of school. And then we have other people that I test and I'm like, oh, you have the Epstein-Barr in your system. Did you ever have mono? No, I never had mono. I don't even feel tired now. Like, that doesn't make any sense. So you can have antibodies in your blood. It doesn't mean that virus is a problem. And it doesn't even mean that when you came in contact with it, that it actually was a problem. So, Coxsackie virus, that's the hand, foot, and mouth. People come up for Coxsackie virus in my testing, but they're like, I never had the sores on my hands or my feet. So you have to understand is that this is not black and white. There is a lot of gray. Just because you have antibodies to something doesn't mean that that virus is a current problem, and it doesn't even necessarily mean that it was a problem when you came in contact with it. So we're sitting here and using testing that is not even necessarily benefiting us. If anything, it's just driving fear. Ooh, this person has coronavirus. If you actually knew how many people have viruses in their body, on average, even people that come to me and they're like, I'm just here because I have minor headaches. I'm just here because I want to get rid of my indigestion. On average, every patient that I test has anywhere between 3 to 4 viruses in their body that are dormant, not causing any problems, but they have viruses in their system. And those viruses will ebb and flow based off of their lifestyle, if they're run down, if they're stressed out. That's why, like, you ever hear that saying, oh, I feel like I need a vacation to recover from my vacation? So when you go on vacation, you're usually staying out later. You might be having more alcoholic drinks. You might be indulging in more sweets. So you tend to kind of run your body down a little bit. So what happens is viruses can come out. They can become active in that moment. So you get back from your vacation, and if you have the Epstein-Barr virus in your system, then that can activate and you feel more fatigued. And then 1 week goes by, your body gets back to normal, and then you're like, oh, I'm fine, my energy's back. So it's just, you have to understand that viruses are all around us. And if we're looking at testing, you can test people for viruses, and people have boatloads of viruses in their body. But it doesn't mean it's a problem, and it doesn't mean that they have a high risk for a bigger problem later down the line. So again, this is just another piece of the puzzle that this is what's dictating how we're going to reopen this country when it's not even necessarily going to give us that good of quality information. And then the other big thing is we want to track where these clusters are. Where are the clusters of the patients that have the virus? Why don't we start looking at the clusters of where there's the most toxicity? So some of you may have heard of something called a Superfund site. For those of you that don't know what a Superfund site is, you should go online. If you're from the US, go to scorecard.org. Scorecard.org. So if you go to scorecard.org and you plug in your zip code, it will actually tell you all of the chemicals and pollutants that are in the air and the water of your county. It will also tell you about something called Superfund sites, which are sites that have contaminated soil or water because there was some type of plant or company that was leaching chemicals into the environment. So Superfund sites technically have a government ordinance to be cleaned up, but when you actually dig into it, you'll find that many of these Superfund sites have never been cleaned up, and they've had this government ordinance for 10, 20, 50 years even. So in the tiny little state of New Jersey, most states on average have anywhere between 4 to 8 Superfund sites. In New Jersey, we have 126 Superfund sites. So yes, people, we are glowing from the inside out. And a lot of these are nuclear power plants that have given off nuclear waste into the soil, which is then contaminated the water. This is also really bad when you get out into Pennsylvania, where they're doing a lot of the fracking. So they're going in and tapping into natural gas. So we're talking about a world of contamination. And then we're also talking about these clusters of coronavirus that are in cities where there are airports and jet fuel. And then we're also talking about it close to like Lake Michigan. That's where another corona cluster is. You know what's also happening there is the runoff from all of the farms and all of the pesticides and the Roundup, the glyphosate, which was made by Monsanto, that is now, you're seeing commercials about it saying, hey, this is now known to cause cancer, which by the way is on all of our food. So when I started really digging into this, because people were talking about 5G and all these different things that might be causing an exacerbation of the coronavirus, but really I study toxicity all the time just based off of what I do for a living, because the type of testing that I do reveals toxicity all the time. And I've learned a lot about it because sometimes you're like, where the heck did this come from? Yes, Newark is a total cluster. I grew up there. And Newark is also one of the areas that the Superfund site for Diamond Alkali, which is where they produce the most Agent Orange that is still contaminated in the ground, let alone being close to the airport, where you're dealing with all different jet fuels and diesel fuels, etc. So we are talking that there is a ton of toxicity, and the areas of toxicity is where we're also seeing the clusters of the coronavirus. So we're sitting here talking about, oh, well, we have to do more testing, and then we have to find the clusters, and then we have to continue to isolate those people, and then we can open up. So we're going to continue to isolate these people based off of virus when really it's a toxicity issue. And unfortunately, at this point in time, the toxicity is not going away because these power plants still exist. They're still pumping stuff out. If you're from New Jersey, you see the Linden power plant that's literally dumping massive amounts of toxins into the air minute to minute. And that plant has been there for years upon years. So we need to start looking at the bigger picture here, because this doesn't just affect us right now in this moment. This is affecting us in the long term. This is what has made people vulnerable in the first place. And if we don't start understanding that there is a lot of other variables here, then we're going to just stay fear-based, and we're going to be scared to shake people's hands, and we're going to be scared to hug our loved ones, which is ridiculous. You know, and I was out today and I see all these people, and I'm required to wear this thing. And I see all these people with their masks on, but then they're still touching everything, and they're touching their cell phones, and they're putting their cell phones to their face. And I'm like, it's such a skewed understanding. I'm like, bacteria, parasites, like they're bacteria, viruses, it's on everything. It's on everything that we touch. It's on our clothes. Like, we can't live in fear of this. What we need to do is we have to understand, why are we vulnerable? And we're vulnerable because we are sick, or we are toxic, or we have autoimmune conditions, or we eat like crap every day because we're on the go and we don't have time. There is so many variables here that have to be considered to understand the grand scheme of things. So when it gets to, you know, really looking at what's going to reopen this state, you know, obviously we're not in the driver's seat. We're able to only be in the driver's seat of our own health and our families. And we need to move out of fear, and we need to move to a place of empowerment by understanding that there is a lot that we can be in control of. There is a lot that we could do to be proactive, and we need to stop looking at this virus as a killer and that it's going to take all these people out, because there is a reason why there are certain people barely being affected and there are certain people that are being highly affected. And unfortunately, we have a very broken model, and that model is not leveraging comprehensive testing. So sick people are walking away from a doctor's visit thinking, well, I must be crazy, or this must be it for me, or it must just be that I'm getting older, and that's why I feel this way, so I better just settle for it. I better just, you know, get used to it. And they're not understanding that, you know, you feel a certain way for a reason. And even if you do have a diagnosis, if you have a diagnosis of migraines or irritable bowel syndrome, even if it's something that, you know, comes and goes, like that, there's a root cause to that. There's always a root cause. And, you know, we are putting Band-Aids on the root cause left and right. That is the foundation of conventional medicine, is cover up the symptoms, put a Band-Aid on it. Oh, you have pain, take a painkiller. And unfortunately, a lot of times they have no idea what the root cause is because nobody's dabbling in understanding toxicity. Your doctor's not asking you, where do you live? Do you live next to a power plant? Do you live in a place that's super toxic? Let me look up the air quality and the water quality of where you live. Like, they would think that that's crazy. Or they would say, go to a toxicologist. So these things matter. And it's really just understanding that we can do things to be proactive, and we can improve our immune systems, and we can really just be able to take away a way bigger knowledge from this whole experience. But obviously, it's a waiting game at this point. But I think that we can all just hope that things will get back to normal, and that we don't have to see these ridiculous things in place that our kids are wearing masks to school. And maybe that we all rally together to say, hey, why don't you feed my kids better food that will actually keep them healthier? Or why don't you get rid of the hot spots and the massive fact that my kids are being radiated all day because of all the Wi-Fi in the schools, or the fact that most schools have asbestos and mold in them. So it's like, no, we'll just ignore all of that, but your kid's going to wear a mask. So this is what we're working with, people. So it's us, the people, that have to rally together and stand for what is right. And that's really what I think can make the biggest difference. So I know that some of you are just hopping on now, but definitely go back to the beginning and watch this. It's really just shedding light on, where we are at, and then where we might be going, and how we can really band together to make an impact in a positive way. So thank you for listening, because I've definitely just been having a day. And it's been a lot to just keep in, but I know that a lot of you guys are feeling the overwhelm, feeling the frustration. And I know that, we're all looking for answers, and we're trying to understand the bigger picture of what the heck's going on here. And are we going to ever get back to normal? So it's, we're all in this together. So it's not, don't think you're alone. Don't think that you're the only one feeling this way. It's a lot of us. And, again, I think it's going to bring us all together in a bigger way, but it's a waiting game at this point. So thank you guys for being with me. I appreciate it. So I'll see you soon.